It's okay? Yeah, be seated. Good morning, ladies and gentlemen. I'm really happy to be associated with this innovative product introduction in our motherland, India. Basically, we are all Indians. You may be from Karnataka, I may be from Tamil Nadu, but we are basically from India. That's what we need to stress. We have an excellent Prime Minister, all of you know that. His vision is Digital India. Digital India. India should become a developed nation by becoming a Digital India. Now Rajinikanth and his team are proposing it should be a digital health. When you have health, you will have a developed nation. Without health, you can't have a nation which is developed. All developed nations, you go ahead, whether it is US, UK or anywhere, why the country has developed, people are healthy. India, we have large number of population, as on date 128 crores, but still we are in the developing stage, developing country group. Why? Health has not been taken care. That is why the medical professions always appreciate technologies. We are trying to adopt technology into health so that we can create a healthy India which leads to a developed India. This is the background, ladies and gentlemen. I was just wondering on the skills of our compere, Rapid Rashmi. She is fitting very well into her acronym. I have been into global meets, but yet to see a person like her. She should cross India and should bring name and fame to India. Of course, my good friend Dr. Shanmunathan, we always know, VCS is always good. I am thankful to Rajini for giving this opportunity, and my good friend Alex for giving you a bird's eye or an overview of the health system where he has stressed need for quality. Need for quality. Today, you buy a sari or you buy a small cloth, you look for quality. And immediately you look for the cost also. When there is a good quality product available at 100,000 rupees, you are not bothered to buy that. When it is available at 10,000 rupees, you are happy about it. What I am trying to say is, when you start feeling the card, you will feel both. It is adding to the quality of healthcare within your budget without biting your purse. This is the first aspect I would like to say. See, I am still a very actively practicing doctor. I am into so many shoes, but my major shoe still today is I am in active practice. My area of practice is cardiology, heart and critical care. That is serious illness. Serious illness. I have seen most number of dead patients who have been brought to me with the hope that life could be brought back. I have seen maximum number of unconscious patients. Over 40 years I am doing it. Wherein I find the major difficulty is getting to know what sort of patient he is. That is a major difficulty, not me. Every doctor who is treating an emergency. See, there is a road traffic accident, somebody is bringing them to. Either 108 ambulance or an auto rickshaw wala, somebody brings him to you and leaves him and goes. And as medical personnel, we need to save that life. The doctor can start a drip, this and that, all things he will do. But he needs information, ladies and gentlemen. Information is the key. Information is knowledge. Medical information is the knowledge to save your life. Simply, Alex was asking, what is a blood group? That blood group of that person is known, immediately blood can be given, he can be saved. When it is not known, you will have to give a slip. Somebody has to pay for the blood group. The technician has to come, he has to check, counter check, sign, and then your blood group will come. By the time is lost. I always say time is life. Business people say time is money. We say time is life. Whose life? Our citizens' life. Therefore, we say that first 1 hour is the golden hour. First 30 minutes is the platinum hour. That is what we say today. Golden hour was an earlier teaching. Whereas platinum hour is the current teaching. Within half an hour, you do the best to the patient, that life is saved. After that, you can do anything. You can change his hand, you can change his limb, you can change his liver, you can change his heart, you can change his kidney, you can do a bypass, anything. When you can do, you have a live patient. That life comes only within the effort of that 30 to 60 minutes. For that, what is needed is information. See, I used to say, a human being need not go to a lawyer. Not necessarily during his or her lifetime to go to a auditor or even to a minister, but has to go to a doctor. Male or female, from birth to death you need a doctor. Home to tomb, we need a doctor. Either for you or for your daughter or for your son or for your grandson or somebody you need. In that doctor profession, what is the level of the information that we are giving to the doctor? Many times, we may not be able to convey the best. Many times, the accompanying person does not know. Even yesterday, there was a very bad problem. We have been he has been treated elsewhere. We are asking for records. He says the record is in his place, which will take 2 days to come. Within that 2 days, that fellow has to sit up. Otherwise, no point in treating a patient. This delay. And he will bring a chit. When we see that, nothing will be there. All writings of the pen, all disappeared with water. He brings an X-ray, not able to see. He brings an ECG, no tracing is there. After 1 month, that tracing will go away. That is how it is created. And record is not available. Even it is available, not legible, not readable, no information is given. Doctor has to do everything from, scrap. Right from beginning, it takes time. It takes money. Therefore, we feel that we are neglected, something good is not done. What is the way? What is the way? What is the way? What is the way? The search is on for nearly about 4 to 5 decades. I am searching for it nearly for 2 decades. Right from my Commonwealth president days, we started that computers can be of use. But how many of us can have a computer? How many of us can operate a computer? How many of us can keep a computer open 24 hours? But all of us today have at least 4 mobile phones. All of us have at least 4 mobile phones. Even a rickshaw puller or a bullock driver has mobile phones. And he is keeping on talking. Then ultimately the healthcare has landed to mobiles. Today, you do everything through your mobile. You buy your shirts or cloths, you pay your bills, and you book your tickets and whatnot through mobile. Then the question came, why not health also through mobile? Why health cannot be through mobile? When I met Rajinikanth for the first time, he had brought a primitive type of a card. And this mobile was going on in my mind. I've been going, searching who can develop. Finally, we landed on him. And in a matter of 6 months, he has made this application working on your mobile. About this smart card, a lot of information have been given. Basically, now you understand all your medical records can be on this. If you see the patients waiting in the, waiting room of the hospitals, like from a sari shop they have come, they will carry, 2-3 bags of scans and X-ray and other things. As I told you, when you open it up, you are not able to see. And it takes at least an hour for a doctor. I have a person who will go through all these records, put all the vital things, and then patient comes to me, so that my time is saved. Whereas here, there is a small card which can operate anywhere. In your USB portal or on a mobile, you can put it on, and immediately the doctor can say, oh, this man has this problem. He has a sugar, he has a BP, he has a fat level, his blood sugar so much, he is on this drug, he has undergone a bypass surgery, he has undergone a surgery for his leg, she has undergone a uterus removal. We don't know whether the lady has a uterus or not. When you ask the patient also, she may not know. I am very doubtful, doctor, whether it has been removed or not. That's the way the answer comes. He has a problem. And all these information doctor can read in 5 minutes, in 5 minutes time. Thereby, this card holds all your health record. That is why it is called as a lifeline. It is my life doctor. That's what the patient says. And it could be viewed very quickly, even as I told you, even on a mobile. And the major crux of the health issue comes in an emergency. In an emergency, in the middle of the night, you may be alone. And like other countries, here also in our country also, the circumstances have come that we may have to live alone. The common family system has gone. When he is alive, how to call a doctor? Or you are coming out of your office, you are hit somewhere, somebody takes you, and you are alone. In that situation, you can press a panic button. A message can go to your doctor. You could have recorded. It should go to X, Y, my wife, my child, and automatically an ambulance 108 will also, know. By GPS it will know. So-and-so, an road has fallen down at this place. An ambulance can come and pick you up. Therefore, your life is saved. That is why it's my life doctor. In a normal situation, in an emergency, and in a cooler situation, all informations are fed to you. And the doctor is able to understand you very quickly. Many times we always find fault with the doctor. Fine, maybe right. But when a right information is given, a doctor will also be able to take a right decision that gives the best health care to all of us. I am sure with Rajinikanth and his team, with their technological advances, they will make it a single card for a human being. Today you open up a purse, you see at least 10 cards there. There is an ID card, there is a credit card, there is an airlines card, and whatnot. And everybody have at least 10 cards. I am sure Rajini with his team will make a single card. Can be an identity card. You go to airline, on the way door, you show the card. You go inside and go to the bank and collect the money. And you go to the doctor, give the same card. And it will make a very single card. As a medical professional, I have something in my mind to support this card. Probably how many of you will be able to understand that is going to be the future of the card. The future of the card. See, today we have got certain devices which could be fitted to the patient when he is at home. See, in my hospital we do these angioplasties and bypass. Those chaps go home. Go home and they are asked to come to the doctor after 15 days or so. But most of the patients will have some problem or other. We tell them, we put it in writing, but still how to monitor. How to monitor. Today systems are available. We call them as sensors. It has come well in developed nations. We are trying to see that how it could be introduced. For example, your heart can be monitored there and it can be transmitted to your doctor. Your sugar can be monitored, can be transmitted to your doctor. Your BP can be monitored and sent to your doctor. If you are a solo person, we call it as a solo care. Nobody is with you. And to remind you of your tablet, to tell you, oh, your sugar is 240, you must adjust this tablet, can be done. It's called as a sensor-based patient health monitoring, which will be the ultimate goal of this global, smart card. I will call it as a global digital health card. I am so happy all of you are, very much interested. Some information I have given you. I think all of you have understood the need for the card. We have all, made things very clear that there is a need. And where it could be utilized, we have our mind, set for certain future developments also. I am sure, as a learned population of this society, you may have a lot of doubts or inputs, which to the possible extent we will be happy to, clarify. With these few words of introduction, I am happy to launch the Global Smart Card today on this auspicious day in Karnataka. I wish this card should take care of the health of Indians, leading to a healthy India, developed India. Thank you, ladies and gentlemen.
Thank you, Dr. Sundaram Arul Raj. We are confident that your dream of taking this global health smart card to all corners of the world will become a reality. Thank you very much, sir. I would now request Dr. Alexander Thomas to unveil a prototype of the card, please. Dr. Alexander Thomas, to unveil a prototype of the card.